Thank you very much, Aditi. And I really want to thank all our speakers for all the different sessions on TB and now this AMR session. I have to say I've been particularly inspired by the brilliant work that's been done around the world in particularly complex and challenging circumstances. So it's fantastic to see that innovations are possible and that we can move forward to tackle the issue of AMR. So much has been covered in the last couple of hours. And what I want to do is just highlight some of the things that I have learned, had reinforced to me by our speakers. I particularly liked what Dr. Reem said around WASH being a human right. And of course, for us as infection specialists, those interested in AMR, and now particularly during the COVID-19 pandemic, we see exactly how important WASH is in terms of infection prevention and control, sanitation in our hospitals, and also particularly around waterborne infections and diseases, which can be a driver of AMR themselves. And so I think discussing AMR through a political sphere, through a social sphere, and now through a human rights sphere is something that's really important for us as a take-home message. There are a few other things to highlight around new technologies and regulation, and I think this is something that's particularly important. So Jean-Baptiste has just highlighted issues around regulation with 3D printing and some of these new innovations, but actually I would argue that we can also be mindful of regulation and governance at an earlier level. So things around limiting over-the-counter use of antibiotics. One of our participants said, why the Middle East? Well, in the Middle East, in some countries still, you can very freely get over-the-counter antibiotics. You can go to a pharmacy and get meropenem. As Dr. Nabil alluded to, the quality control, particularly during conflict and humanitarian crisis, of some of these antibiotics can be substandard, and that in itself can drive antimicrobial resistance. And of course, patients, their physicians may be giving inappropriate antibiotics, lower doses, shorter courses, for a variety of reasons, including costs and financing for these patients. There's two take-home messages from me as we end the session. The first is just how important it is to take a multidisciplinary and interdisciplinary approach to understanding and tackling AMR. We need diagnosticians, we need those who are interested and aware of environmental impacts in terms of AMR. We need closer working with some of our veterinary colleagues because, of course, antibiotics in the veterinary sphere are widely used and can in themselves be a driver of antimicrobial resistance. With colleagues, including Nabil and others, there has been discussion around weaponry and its influence on antibiotic resistance. So the influence of heavy metals and the remnants of war as drivers of AMR in the environment and in effluent. And actually it's particularly important in countries such as Syria, perhaps Lebanon, but particularly in Gaza, which has sadly seen increase in conflict and injuries associated with different weaponries and also with heavy metals. And so this is something that needs to be studied even further. There's some early work by various colleagues in Lebanon and elsewhere, but this is something that can be worked on more for us to really understand all the complexities in the environment and all the other drivers in conflict of antimicrobial resistance. What I am going to end with, and it's been highlighted in Syria, but perhaps also in Lebanon and elsewhere, the exodus of healthcare staff. So even before the conflict in countries such as Syria, infectious diseases and microbiology was weak. And actually with the exodus of staff, healthcare workers are struggling to deal with some of the complex infections that we face as a result of the conflict. And of course, other uses of antibiotics. So this year is the WHO Year of the Health Worker. And as such, I think I'd like to reinforce to all our participants, both within MSF and outside of MSF, the importance of investing in staff, investing in education, and alongside that, of course, speaking to our communities and our patients to understand why they use antibiotics, because of course, these patient attitudes, staff attitudes are really important for us in how we address and tackle antimicrobial resistance. So I see Aditi has come back on screen, and so I'm going to stop there, but I really want to thank MSF Asia Scientific Committee for the fantastic work in helping us organise this AMR session, and of course to all our speakers for such an eye-opening, fascinating and wide-reaching session. So thank you and enjoy the rest of the MSF Scientific Day.